Hey everybody, let's talk anti-aging and what does it mean. What we find out is that as we reach the age of 40, and maybe even earlier in some people, that Mother Nature slowly starts turning our hormones off. Our estrogen levels decline, our progesterone levels decline, testosterone, growth hormone, DHEA, cortisol, all those levels start declining, thyroid as well. What we do here at Complete Laser Clinic as a board certified anti-aging physician is we'll get a saliva test from you, and with using the saliva and sometimes a little bit of blood work, we can tell exactly what level your hormones are in your body. That cost, which is important to a lot of people, is $150. That's sent off to the lab and your tests come back. Then we call you in here and we talk about your hormones. And we give you a hormone sheet and we talk about your symptoms. And then if you're interested in getting in the program, then that cost becomes $250 a quarter. And what that cost covers is me covering your prescriptions, me examining you, making sure you qualify, and calculating the exact dose of hormone you need. Every 3 to 4 months we retest your saliva kit for a year. We retest your saliva levels and make sure that they're accurate. Make sure we're not giving you too much testosterone, too much progesterone. When you take hormones, what's that going to do for you? That's going to improve your cognitive function. You're going to be able to think better. You're going to be able to think quicker. You're going to be able to remember a lot better. It's going to improve your smell, your sight, your ears, your toast, your taste. When you start replacing your hormones, what's that going to do for you? That's going to improve your cognitive function. You're going to remember better. Your mind's going to be sharper. You're going to be like when you were 20, 24 years old and you could think and answer and go. Your 5 senses, eyes, ear, nose, taste, they're all going to be better. Your smell. Everything gets improved with hormone replacement therapy. Your muscle mass on your arms. You don't have that crepiness in your skin. Your muscle mass improves. Your skin tightening improves. The glow on your skin improves. It's absolutely tremendous what getting your hormone levels back to age 40 can do for you. When we get low in hormones, we become insulin resistant, we develop metabolic syndrome, and we start storing fat all around our waist. You notice that as we get older, we store more and more fat around our waist, and it seems like our body becomes almost like a Christmas tree. When you take hormone replacement therapy, your waist shrinks up, your shoulders broaden, you get your muscle mass back, you get your youth back. That's why hormone replacement is so essential, especially when you get close to the age of 40. Now, there are risks to that. If you have active cancer, hormone therapy can make your cancer worse. Any type of hormone will stimulate growth cell, will stimulate cells to grow, and that can also stimulate cancer cells to grow. So that's why we check you and we screen you very well for cancer. If you take hormone therapy right, there was a big study done years ago that showed that if you take hormones by mouth, especially the estrogen-progesterone combination, that it increases your risk for heart disease, increases your risk for stroke, increases your risk for breast cancer. The great thing they found that is if you take bioidentical hormones as a cream, it actually decreases your risk for stroke, decreases your risk for heart disease, and decreases your risk for cancer. So come on board. I think that you're in the best place to be to get evaluated properly for hormone replacement therapy. We will check you, we will follow your hormone levels, we won't let them get too high, we won't let them get too low. We'll monitor your symptoms, we'll make sure that you are tuned, just like a car, tuned to the best you can be. And you'll have a great quality of life, and your youthfulness will stay with you for a very, very long time.